Blood is a fluid connective tissue. It circulates continually around the body, allowing constant communication between tissues distant from each other. It transports oxygen from the lungs to the tissues, carbon dioxide from the tissues to the lungs for the excretion of nutrients from the alimentary tract to the tissues, and cell wastes to the excretory organs, principally the kidneys. Blood is composed of a clear straw-colored watery fluid called plasma, in which several different types of blood cells are suspended. Plasma normally constitutes 55% of the volume of blood. The cellular fraction of blood accounts for the remaining 45%. The two fractions of blood cells and plasma can be separated by centrifugation, spinning, or by gravity. When blood is allowed to stand, blood is about 7 of body weight, about 5-6 liters in a 70 kilograms man. This proportion is less in women and considerably greater in children, gradually decreasing until the adult level is reached. Blood cells are synthesized mainly in the red bone marrow. Some lymphocytes additionally are produced in lymphoid tissue. Red blood cells are biconcave discs. They have no nucleus and their diameter is about 7 micrometers. Nucleated MCVGT94 fluid. The hemoglobin content of each cell is normal or raised. The cells are fragile and their lifespan is reduced to between 40 and 50 days. Depressed production and early lysis cause anemia. Vitamin B12 deficiency anemia. Pernicious anemia. This is the most common form of vitamin B12 deficiency anemia. It is commonest in females, usually between 45 and 65 years of age. It is an autoimmune disease in which autoantibodies destroy intrinsic factor if in parietal cells in the stomach. Dietary deficiency of vitamin B12. This is rare except in true vegans, i.e. when no animal products are included in the diet. The store of vitamin B12 is such that deficiency takes several years to appear. Complications of vitamin B12 deficiency anemia. These may appear before the signs of anemia. Beca use. Vitamin B12 is used in myelin production deficiency leads to irreversible neurological damage, commonly in the spinal cord. Mucosal abnormalities such as glossitis, inflammation of the tongue are also common, although they are reversible. Folic acid deficiency anemia. Deficiency of folic acid causes a form of megaloblastic anemia identical to that seen in vitamin B12 deficiency, but not associated with neurological damage. Aplastic anemia. Aplastic hypoplastic anemia results from bone marrow failure. Erythrocyte numbers are reduced since the bone marrow also produces leukocytes and platelets. Leukopenia, low white cell count, and thrombocytopenia, low platelet count, are likely to accompany diminished red cell numbers. When all three cell types are low, the condition is called pancytopenia and is accompanied by anemia, diminished immunity, and a tendency to bleed. The condition is often idiopathic, but the known causes include drugs, e.g. cytotoxic drugs, some anti-inflammatory and anticonvulsant drugs, some sulfonamides and antibiotics, ionizing radiation, some chemicals, e.g. benzene and its derivatives, viral disease including hepatitis, leukocyte disorders. Leukopenia. In this condition, the total blood leukocyte count is less but not associated with neurological damage. Aplastic anemia. Aplastic hypoplastic anemia results from bone marrow failure. Erythrocyte numbers are reduced since the bone marrow also produces leukocytes and platelets. Leukopenia, low white cell count, and thrombocytopenia, low platelet count, are likely to accompany diminished red cell numbers. When all three cell types are low, the condition is called pancytopenia and is accompanied by anemia, diminished immunity, and a tendency to bleed. The condition is often idiopathic, but the known causes include drugs, e.g. cytotoxic drugs, some anti-inflammatory and anticonvulsant drugs, some sulfonamides and antibiotics, ionizing radiation, some chemicals, e.g. benzene and its derivatives, viral disease including hepatitis, leukocyte disorders. Leukopenia. In this condition, the total blood leukocyte count is less than 4,109 L 4,000 cubic millimeters. Granulocytopenia. Neutropenia. This is a general term used to indicate an abnormal reduction in the numbers of circulating granulocytes, polymorphonuclear leukocytes, commonly called neutropenia because 40 to 75 of granulocytes are neutrophils. A reduction in the number of circulating granulocytes occurs. Polymorphonuclear leukocytes, commonly called neutropenia because 40 to 75 of granulocytes are neutrophils. A reduction in the number of circulating granulocytes occurs when production does not keep pace with the normal removal of cells or when the lifespan of the cells is reduced. Leukocytosis. An increase in the number of circulating leukocytes occurs as a normal protective reaction in a variety of pathological conditions, especially in response to infections. When the infection subsides, the leukocyte count returns to normal. Pathological leukocytosis exists when a blood leukocyte count of more than 11,109 L 11,000 cubic millimeters is sustained and is not consistent with the normal protective function. One or more of the different types of cell is involved. Leukemia. Leukemia is a malignant proliferation of white blood cell precursors by the bone marrow. It results in the uncontrolled increase in the production of leukocytes and/or their precursors as the tumor cells enter the blood. The total leukocyte count is usually raised, but in some cases it may be normal or even low. The proliferation of immature leukemic blast cells crowds out other blood cells formed in bone marrow, causing anemia, thrombocytopenia and leukopenia, pancytopenia. Because the leukocytes are immature when released, immunity is reduced and the risk of infection high. Some causes of leukemia are known, but many cases cannot be accounted for. Some people may have a genetic predisposition that is triggered by environmental factors, including viral infection. Other known causes include ionizing radiation. Radiation such as that produced by X-rays and radioactive isotopes causes malignant changes in the precursors of white blood cells. Chemicals. Some chemicals encountered in the general or work environment alter the DNA of the white cell precursors in the bone marrow. Genetic factors. Identical twins of leukemia sufferers have a much higher risk than normal of developing the disease, suggesting involvement of genetic factors. Types of leukemia. Acute leukemias. These types usually have a sudden onset and affect the poorly differentiated and immature blast cells. Acute myeloblastic leukemia (AML) involves proliferation of myeloblasts and is most common in adults between the ages of 25 and 60. Risk gradually increasing with age. The disease can often be cured or long-term remission achieved. Acute lymphoblastic leukemia (ALL). Acute lymphoblastic leukemia (ALL) is seen mainly in children who have a better prognosis than adults with up to 70 achieving cure. The cell responsible here is a primitive B lymphocyte. Hemorrhagic diseases. Thrombocytopenia. This is defined as a blood platelet count below 150,109 L 150,000 cubic millimeters, but spontaneous capillary bleeding does not usually occur unless the count falls below 30,109 L 30,000 cubic millimeters. It may be due to a reduced rate of platelet production or increased rate of destruction. Reduced platelet production. This is usually due to bone marrow deficiencies and therefore production of erythrocytes and leukocytes is also reduced, giving rise to pancytopenia. Increased platelet destruction. A reduced platelet count occurs when production of new platelets does not keep pace with destruction of damaged and worn-out ones. Autoimmune thrombocytopenic purpura. This condition, which usually affects children and young adults, may be triggered by a viral infection such as measles. Antiplatelet antibodies are formed that coat platelets, leading to platelet destruction and their removal from the circulation. Vitamin K deficiency. Vitamin K is required by the liver for the synthesis of many clotting factors, and therefore deficiency predisposes to abnormal clotting. Hemorrhagic disease of the newborn. Spontaneous hemorrhage from the umbilical cord and intestinal mucosa occurs in babies when the stored vitamin K obtained from the mother before birth has been used up and the intestinal bacteria needed for its synthesis in the infant's bowel are not yet established. This is most likely to occur when the baby is premature. Deficiency in adults. Vitamin K is fat-soluble and bile salts are required in the colon for its absorption. Deficiency may occur when there is liver disease, prolonged obstruction to the biliary tract, or in any other disease where fat absorption is impaired, e.g. celiac disease. Congenital disorders. The hemophilias. The hemophilias are a group of inherited clotting disorders carried by genes present on the X chromosome, i.e. inheritance is sex-linked. The faulty genes code for abnormal clotting factors, factor VIII and Christmas factor, and if inherited by a male child always leads to expression of the disease.